It's been roughly about 2 months since I had my last Kshar Sutra thread removed, and as promised, I'm back with another update. I don't really feel like I have too much to tell because everything has gone well. I am not a doctor, but I feel like I'm completely healed by now. There is no discharge coming from the wound or from my anal area at all anymore for about, I guess, for about a month and a half, roughly. There was this thin watery discharge coming from my anal area, and that really tapered off over time. At first it was quite a bit, and then it just over time it got less and less and less until there was nothing at all. And there's nothing at all anymore. There's no real mucus around the area. I remember in one of my videos I talked about having little bum boogers when I would look at the area sometimes, and there's really nothing there much at all. So I feel like this is a pretty boring update, but I do know that people are curious to see how my healing is coming along, and of course everybody who has a fistula wants to know if somebody's had a procedure, if they're cured, and they want to hear from people who've been cured and whether or not they've experienced any issues. So here I am. I think the wound is healed. No discharge. My wound in my rectum, I had my abscess drained about a year or so ago, and the doctor had to drain it externally. It was a Canadian surgeon, so he burned a hole straight through my body, straight through to my rectum. And when that healed, there was a bit of a divot in my rectum, and so I guess that was always there. He did comment on it when he gave me a rectal exam later on down the line. Then I developed a fistula, chose to go visit Dr. Bapat for Kshar Sutra treatment, and I had hoped that my rectum would heal, the wall would just heal flat, but there is still a small divot. So if your rectal walls are kind of like this, it's just this little teeny tiny, I don't know, this little tiny cup, so it's just kind of like a little divot there. And I contacted Dr. Bapat and I just asked him about it because I didn't know how things were going to heal, and I had hoped that it would heal up just completely the way it was before. He said that he expected that the wound would get more, well, the area would get more shallow, but he wasn't quite sure if it would go back to normal, the way it was before I developed the abscess and everything, and that made sense. Of course, I wish that my body had healed perfectly flat, I guess, flat rectal walls the way they were before, but I don't think that's the case. It doesn't hurt. The divot doesn't hurt. It's not big enough or deep enough for stool to get locked or trapped up in the area, so there's no real problems with that. But I've noticed that I need to take a little bit of special care after I have a BM to make sure that the area is completely clean and that nothing's got caught in that little, it feels like a little tiny lip in my rectum on that little side. And by tiny, I mean it's like maybe the size of like a Q-tip head or half a Q-tip head. It's very, very small. But other than the special care that I need to take after a BM, things are fine. There's no pain during a bowel movement. I do find that I have to concentrate more to try to hold in wind if I feel like I need to, but like I said in one of my other videos, I'm one of those very immature people who've never grown up and I think farting is hilarious, so I don't really typically feel the need to hold back having a fart if it's coming through. I think it's a natural body function, and why try to stuff it up there? So anyway, if I do feel the need to pass wind, and I do feel the need to kind of hold it in until I can go to a more private location, it does take a little bit more effort to do so. And so I'm trying to remember and get into the habit of doing, I think they're called Kegel exercises, if I'm not mistaken. An exercise is just to kind of clench your muscles in the anal area and try to strengthen them. But I'm wondering, perhaps, since there is that small little divot in my rectum, maybe that would be something that would make it harder for me to control wind. And that was just my personal healing. That divot was there to begin with. I don't think it was created because I had Kshar Sutra treatment. I think it was there because the abscess in my rectum was so big, the Canadian surgeon put his finger right through it, and then he had to go back in and re-drain the area because the first drainage didn't work. So with all of that trauma to the area, that's just how that area healed, and that's the way it was before I even went to India to have Kshar Sutra treatment. Even though I do have to concentrate pretty hard if I want to try to hold in wind, I don't have any issues holding in stool really at all. So if anybody's concerned about that, for my personal healing, there's been no problems with that. There's been times I've had to hold stool in. You can't always get to a washroom right at the second that you need to, and I've never had an issue with that. So I think that things are fine. It's just that whenever you have trauma to any area of your body, I don't think it's common for things to just work the way they did before things were broken, and I think that's what's going on with my rectum. It works perfectly fine. It's just not quite the same as it once was. Interestingly enough, my rectum has developed a bit of a quirk, and this happened before when I had my abscess drained and then I had my seton in. But I find that now whenever I have to have a bowel movement, the area where the abscess was, it feels like there's a bit more pressure on the area. So you know how sometimes you have to use the washroom, but you're kind of like, do I really need to use the washroom or don't I? Is it just a fart? Or do I really need to go, or can I hold it? I can tell now whether or not it's wind or it's stool by how the area feels. It just feels like in that one small area where the abscess used to be and now there's a bit of a divot, it feels like there's pressure on the area, and I kind of call it my warning signal from my rectum that I do need to have a bowel movement, because I assume as the feces is sitting in your rectal area waiting for the opportune time to go out and into a toilet, I assume that that's putting pressure on the area, which I'd never ever felt before my bum blew up, but now I do feel just in that one spot where I had the abscess before, I feel this pressure, and I know by that I do need to use the washroom, and that's pretty much that. It doesn't hurt, it doesn't bother me on any level, it's just that I'm aware of it. Other than those few things, everything is honestly great. I have more energy than I did before. I still feel very, very, very grateful to have my life back. That hasn't changed yet, and I hope it never does. I am still on a mostly vegetarian diet, although I do eat chicken, and I do eat fish and eggs. And we installed a bidet in our washrooms, which we use all the time, and it's wonderful. So those are some things from India that I took during my healing journey and have incorporated them into my regular day-to-day life. And I would recommend that to anybody if you're interested, or at least look into installing or getting a portable bidet if you have a fistula, because it just makes cleanup so much easier. And it really, I think that if I had had a bidet when I had a fistula, that my life would have been it still would have been negatively impacted, obviously, but that would have been a huge help in my day-to-day life. And I guess that's it. Other than that, right now it's January 2017 in Canada. We are in the dead of winter. It's absolutely freezing cold here. I wish I was back in Pune all the time for the weather, obviously, but just because it was such an amazing experience, and I miss so many things about the culture there. So I would say, again, that in my opinion, I'm healed. Things have gone back to, well, not normal, but they are the way, this is my new normal, and I feel fine. And I hope this reassures anybody who's watching my videos or stumbles on my videos if you're considering a Kshar Sutra treatment. I think as far as having a surgery in your anal area, as far as having surgery on a fistula, especially one that's a high or complicated fistula, this is the most minimally invasive type of treatment you can possibly have. And anybody I've talked to, and the people I talked to, I was lucky enough to connect with them. They've been healed for years. Never had any issues with incontinence, never had any problems with recurrence or anything like that. and so far, so good. I will keep you guys up to date, just because I know people want to hear, will probably want to hear from me 6 months down the line, maybe a year down the line. I would encourage anybody who is thinking about treatment option or surgical option for their fistulas, or if you've had you have underlying health conditions like Crohn's disease or diabetes or ulcerative colitis, but especially Crohn's disease. I know that sometimes surgeons can be hesitant to operate on people with that health condition. Kshar Sutra is an excellent option for fistulas in people with Crohn's disease, fistulas that have multiple openings, recto-vaginal fistulas. If you have a J-pouch, if you have an ostomy, if you have a fistula that's very, very long. I think one person I know of, they had a fistula that was something like 13 centimeters long. If you have a fistula that's very, very wide in diameter, Kshar Sutra is an excellent option. It's also a great option for people who have had multiple surgeries, conventional surgeries in their home country, and they failed. Basically, as far as I know, Kshar Sutra doesn't seem to have any of those limitations that maybe conventional surgeries that we're used to in North America or in other countries outside of India. Other surgeries that are not Kshar Sutra tend to have. So I guess my only message is to, as much as possible, try not to be afraid, and certainly just look into this option. Talk to as many Kshar Sutra doctors as you can and choose the doctor who you feel is a good fit for you. And if I were you, I would say certainly if it feels like a good fit for you, go for it. I went for it, and in my opinion, it worked for me, and it's absolutely been life-changing.